As John has said, and I would ask you, most of us who are in this room, when we got up this morning, we didn't have to think about what we were going to eat, when we were going to eat, and if we had enough money to buy that food. Those are choices that we can make easily. But as John has said, for some of our fellow Hoosiers, that really is not amenable to them. They face food insecurity issues on a daily basis. Food security really is defined as the state of being without reliable access to sufficient quantity of affordable, nutritious food. We all know that. And which one do I hit? All right. In terms of the scope of the problem in Indiana, we all know that in Hamilton County, 9% of the population faces food insecurity issues. And in Marion County, that is about 19%. I think John mentioned about 20%, but what I got was 19%. And so I want to talk a little bit about how Community Health Network is engaged in this problem. The first thing that we actually do, we have a cupboard, and I would like to also just mention that Gleaners Food Bank is a major contributor, a major provider of our cupboard. It is a client choice food pantry that specifically serves residents of Lawrence Township in that specific zip code. But I will add that if we have someone who comes to the cupboard, does not live in Lawrence Township, we don't turn them away. Our partners include, as I mentioned, Gleaners Food Bank, Midwest Food Bank, Brandywine Creek Farms, Filegi Hiawat, which is a community farm. We also have Myers, and as well as CVS. Now you may ask, why CVS? CVS provides personal items to the food pantry. I want you to think not only in terms of providing food for the body, but also many of our patrons who come to the food bank look forward to receiving soap, shampoo, deodorant. Those personal items that we take for granted, but they don't take for granted. We say, we're going to give you food, we'd like for you to go to work, but when they don't have those personal items to use, it is very uncomfortable to do that. So we found that having that piece to provide to the citizens who come to us is very rewarding. In 2016, the cupboard served over 57,000 individuals, which represent about 13,000 households. And as you can see in this picture, we have community volunteers, our own employees, who go to the pantry on Wednesday and Friday and provide their time. And in fact, working for a Community Health Network, each employee is required to do an act of service. And so many of our employees really like to do that. They look forward to serving our patrons. In terms of the rolling harvest, I know that some of you have heard about the rolling harvest. When I first took this job in late February, in about March, we had Jonathan Lawler from Brandywine Creek Farms to come talk to us about food insecurity issues. And as you can see, one conversation led to another. And we thought how beneficial it would be if we would go out into the community. We often expect people to come to us, but as you heard, many of those people don't have transportation. So we decided we would go to them. And this was really appropriate because this was right in the height of the Marsh supermarkets closing. And we found that this generally affected many of our patients and many of our citizens in the community on the east side. And so we decided that we would work with Jonathan to bring fresh fruits and vegetables to those in the community. And as you can see, we have the trailer here that we put up, and people actually look forward to seeing that trailer because they knew fresh fruits and vegetables would be there. It is a pilot program. We named it a pilot program so that we would be nimble, we could adjust to different scenarios. Again, we partnered with Brandywine Creek Farms, and the purpose was to address food insecurity. And the pictures that you see here, every 2 months, leadership at community gets together to talk about those issues with community. The one thing that we did do at the last LDI on August 25th was to work with Jonathan Lawler to pack food for those people in the community who didn't have it, and we would take those bags to them. And so we packed over 1,200 bags, and I think that equated to 16 to 18,000 pounds of food. That included fresh fruits and vegetables. Also, we packed I want to say, food that would stand the test of time. And so when we took those bags, not only to members in Marion County, but also to Howard and Kokomo, to Anderson, people really thought that that was a really great idea, and we plan on doing this on an annual basis. The Rolling Harvest food truck went out into the community. Where were those stops? Certainly we went to Community Hospital East. We went to the Shepherd Community Center. We had Rolling Harvest to go to the cupboard on Friday. And we also had them to go to the Community Alliance for the Far East Side. My time is going really fast here, but we served an additional 800 to 100 persons. And as you can see with the survey, people thought that it was a great idea and that they would not, had not for Rolling Harvest, they wouldn't have access to food. In terms of the Meal on Wheels, we are engaged with them to do a pilot program in which members, patients would be identified prior to discharge to the hospital. They would get food for 4 weeks. They would also receive 2 nutritional counseling services, and after 30 days, they would have the option to continue after 4 weeks. The genesis of that program is to make sure that, number one, we are targeting patients who have diabetes or cardiovascular disease, to make sure that they get the food that's necessary. We reduce the readmission rates with regard to coming back into the hospital, and make sure that patients know that there's a program where food is available. And finally, in 10 seconds, in Community Hospital Anderson, they are sprouting a community farm on campus. This is a really neat idea, and we really would like to have this in Indianapolis. And with regard to the source of it, would be a source of nutrition not only for employees and patients at the hospital, but to the community as well. And so we're just trying to take a little bite at a time. Our patients really appreciate it, and we really look forward to any feedback that you may have with regard to what we're doing. So thank you very much.